Medical miracle. That's how many healthcare professionals describe me because I am still alive. Who am I to disagree? I survived multi-system organ failure, cardiogenic shock, cardiac arrhythmia, and currently surviving one of the most fatal cancers that statistically should have killed me 3 years ago. My cancer treatment is a medical roller coaster ride of physical, emotional, and psychological side effects from which I've learned so much. So, while I'm alive and able, I'm sharing my story, insights, and lessons learned to increase public awareness of what it's like to deal with cancer. I also want to provide caregivers helpful insights and inspire other cancer survivors to never give up the fight. This is my story. In 2019, while living and working in Saudi Arabia, I started feeling extremely fatigued for no obvious reason. This wasn't something that coffee or a nap could resolve. It made my arms and legs feel like lead. It kept me exhausted and unable to power through the day and didn't relent no matter how many hours I slept. I also had bone pain, no appetite, and unintended weight loss. For months, I pushed through those symptoms until I couldn't anymore and finally went to the hospital. Blood tests revealed I was dangerously anemic, and that's why I felt so extremely fatigued. And because I was completing the work project, I ignored the multiple myeloma warning signs, including bone pain, loss of appetite, weight loss. Sound familiar? As a result, my health was already deteriorating and my condition was approaching critical. Consequently, I was hospitalized, and once stable enough to travel, my doctor wanted me to return to the United States for treatment. On 1 September, I was medevaced to MedStar Georgetown University Hospital in Washington, D.C. After checking in, my condition worsened as I developed pneumonia and had difficulty breathing. Since these developments were life-threatening, I was moved to the ICU. Meanwhile, lab results confirmed I had one of the most fatal cancers, plasma cell leukemia, a rare, particularly nasty subset of multiple myeloma. And here's the scary part. My doctor emphasized plasma cell leukemia isn't leukemia like most people know it. It's very severe, very serious, and I could die. Statistically, I had only 7 to 14 months to live. The initial treatments of chemotherapy and other drugs, platelet transfusions, and blood transfusions stabilized me. About a month later, I was discharged. I didn't look like the model of health, but I was alive. The treatment plan was return in a couple of weeks for another round of chemotherapy and then have 2 stem cell transplants. Things were going well until 19 November 2019. That is when my resting heart rate skyrocketed to 130 beats per minute and I experienced extreme shortness of breath. I was in multi-system organ failure due to chemotherapy. My kidneys had already failed and my liver and heart were just beginning to fail. I was told my liver's carbon monoxide levels were too high and I needed to see a liver specialist immediately. So I was medevaced via helicopter to a hospital in Richmond, Virginia, where they had a hepatologist and an open ICU bed. I do not recall the flight, but I do recall the cost. $62,000, the most expensive flight I'll never remember. After I arrived, the ICU team gave me medication for my liver and my heart. Amazingly, a few days later, my liver values stabilized. However, my heart remained in serious trouble. The following day, a doctor informed my wife I could die of cardiogenic shock because my heart wasn't pumping enough blood to meet my body's needs. The average is 55 to 75%. I was at 10 to 15% and declining. Below 30% is considered very severe heart failure. The doctor told her, "We've done the tests and his heart function is extremely poor. We don't expect him to survive." And then she asked, "Do you have an advance directive?" Then declared, "He has a week to live." Later, a cardiologist told me I had cardiac arrhythmia and needed a cardioversion to restore my heart's normal rhythm. Cardioversion stops the heart, then shocks it back to life, akin to pressing a reset button to restore normal operations of some equipment. The cardioversion was successful. It also increased my heart function to 40% and was expected to improve over time. Finally, after dealing with breathing, liver, and heart issues, doctors refocused on my cancer treatment plan by moving forward with 2 stem cell transplants. Both put me in remission, but neither lasted beyond 9 months. So later, my oncologist initiated immunotherapy, which activates the body's immune system to attack cancer cells while sparing healthy ones. That, along with other cancer-fighting drugs, worked and is still working via targeted therapy and active treatment. And although I'll always have cancer cells, the levels are low enough and being held in check by weekly immunotherapy infusions. During this journey, I discovered several insights and lessons learned, but I only have time to touch on 7. First, if someone tells you you're going to die, you neither have to agree or give up fighting for your health. That was and remains my strategy, and here I am. Ta-da! Second, prayers work. At Georgetown, the chaplain asked if he could pray for me, as did for other nurses, 2 hospital volunteers, and the staff at my dialysis center. I felt like I had "Pray for Me" tattooed across my forehead. Not that I'm complaining. Prayers re-energized my determination to fight through and survive my disease. And I am convinced I am alive because when combined with advancements in fighting cancer, those prayers and my faith are contributing to my survival. A friend told me God wasn't ready for me and the devil didn't want me. Third, cancer patients need a trusted caregiver and decision maker. My wife filled those shoes. Caregivers are advocates and support for the patient. They help manage daily activities, sort medications, collaborate with medical staff, and sign paperwork on the patient's behalf. For example, although I was sedated, someone occasionally asked me to sign paperwork authorizing a medical action or procedure. I had no idea of what I was signing. Had my caregiver not been there to scrutinize and explain the content, I could have literally signed my life away. Caregivers also need to be good note takers, as the patient is unlikely to recall some of the conversations with doctors. Fourth, cancer patients need at least one cheerleader in addition to the caregiver. Mine is my older brother. After my wife informed him about my situation, my brother flew to Colorado and was at my bedside within a week. His presence gave her support and time to catch her breath, reduce stress, and avoid caregiver burnout. For example, every couple of days, they swapped off talking to doctors, staying by my bedside, sleeping in the room's lazy boy recliner. And when he wasn't sitting bedside, he tended to chores at our home that I couldn't do while I was hospitalized. And this is important. He and my wife boosted my morale, re-energized my determination to do better, and helped me focus on the positive and away from feeling depressed, discouraged, or drifting into a dark place. Like caregivers, cheerleaders need to be good note takers. Nearly everything I shared is based on caregiver and cheerleader notes because I was too zoned out to know what was going on. Fifth, people need to be mindful of chemo brain. Chemo brain describes thinking or memory problems, mental cloudiness, decreased mental sharpness, and difficulty concentrating or learning new skills during or after treatments for leukemia. Be patient with anyone undergoing chemotherapy because it can cause cognitive changes or make them unusually forgetful, confused, or genuinely foggy. For example, initially I had to ask my wife multiple times basic things like our telephone number, zip code, and how to spell simple words. 6. Patients need to be comfortable with humility while being treated. At one point, I lacked physical coordination and depended on others to assist me with personal things I'd normally do myself. For example, after using a portable bedside commode, I stood up, hugged my wife for support and balance, while a nurse wiped my rear. To the nurse, it was business as usual. To me, it was humiliating. However, after the first couple of times, it became a non-event. When I proved I could handle matters myself, I felt like a 3-year-old having his first successful solo poop. I imagined the nurse delightfully clapping her hands and excitedly telling the others of my accomplishment. Oh, he went poo, he went poo. And 7th, no matter what, cancer patients need to be optimistic and maintain a positive fighter mindset. Between 15 and 25% of those living with cancer are affected by depression. Research confirms a person's attitudes and perceptions can be modified to reduce depression and improve health. We're talking about the power of positive thinking. From day one, I've maintained an optimistic, positive mental attitude. And although I did and do have moments of depression, I snap out of them when I consider how fortunate I am to be alive. I leave you with 4 thoughts. First, don't ignore it when your body is talking to you. Had I continued to do so, I would have probably died. Second, there are lots of ups and downs, twists and turns, and other cancer-related issues and challenges with which one must deal. In my case, problems with breathing, my liver, and my heart temporarily replaced cancer as the #1 concern. This was not and is not a linear experience. Third, people without cancer should consider being a cancer giver or cheerleader. Their emotional assistance and support will be essential to the cancer patient's positive mindset and health. And fourth, I encourage cancer patients and caregivers to join the conversation by writing a paragraph, article, or book about their experience. Besides being therapeutic, it contributes to the cancer knowledge bank from a patient's perspective. It also helps those without cancer understand what it's like to live with this disease and can promote dialogue and understanding between those with cancer and those without. I've already started my article and plan on writing my book. Stay tuned. Thank you.